Did you know? Colon polyps are small growths in the large intestine, or colon, that are present in approximately 30% of people aged 45 years and older. What are colon polyps? Colon polyps are small growths that arise from the inner lining of the colon and rectum. Colon polyps can come in different shapes and sizes, including flat, sessile, or pedunculated polyps. They also look different under the microscope. What are the different types of colon polyps? At the cellular level, colon polyps fall into three main categories. First is tubular, tubular villus, or villus adenomas. Secondly, sessile serrated adenomas. And lastly, hyperplastic polyps. Colon cancer develops almost always from adenomas as they grow bigger. In comparison, hyperplastic polyps are almost always benign or non-cancerous. What does the presence of dysplasia in polyps mean? Under the microscope, polyps also have different degrees of dysplasia. Dysplasia describes how much a polyp looks like cancer under a microscope and are generally classified as either low-grade dysplasia or high-grade dysplasia. What risk factors are associated with colon polyps? Colon polyps are associated with older age, male gender, race and ethnicity, smoking, inflammatory bowel disease, family history of colon polyps, obesity, type 2 diabetes, and certain genetic syndromes such as Lynch syndrome and familial polyposis syndrome. What are the symptoms of colon polyps? Most people with colon polyps have no symptoms. As colon polyps grow larger or turn into cancer, people may develop the following symptoms: blood in the stool, constipation or diarrhea, change in the color of your stool, abdominal bloating and pain, weight loss, fatigue due to iron deficiency anemia. If you are experiencing any of these symptoms, speak to a gastroenterologist who specializes in colon polyps and other digestive diseases. How are colon polyps diagnosed and treated? Your gastroenterologist will recommend a colonoscopy. A colonoscopy is a procedure where a flexible tube with a light and camera is inserted into your colon to look for colon polyps and colon cancer. And along with the help of AI in colonoscopy, which can help to enhance adenoma detection rate. Depending on the size of the polyps can usually be removed during the colonoscopy using a metallic snare or biopsy forceps. The polyps are then sent to the lab to be analyzed by a trained pathologist under a microscope. Your doctor will discuss the results of your scope, biopsy report, and the timing of your next screening colonoscopy. In general, the timing for your next screening colonoscopy depends on many factors, including 1. Quality of colonoscopy. 2. The number and types of polyps detected. If you want to know more about colon polyps, colonoscopy, or your digestive health, visit us at www.gutcare.com.sg to make an appointment today. More information can be found in the video description below. Like, share, and subscribe for more.